Hi ma'am, how can I help you? What brings you to the emergency room or the urgent care or the doctor's office? Oh, she just broke up in this rash and she's had a fever. For how long? For the last 3 or 4 days. Any runny nose? Yes. And she's not eating as well. She's got a poor appetite. Okay. And she complains of a headache as well. Okay, were you able to check the fever or the temperature at home? No, I don't have a thermometer, but she felt fairly hot. Interesting. Well, we got some good keys here so far. Mild fever, upper respiratory symptoms, irritability, headache, and a rash that just erupted. It scared the mom, and she rushed over to see you. So what do we have going on here? This is when you tell the parents. Well, it looks like the baby's got erythema infectiosum. What? Erythema infectiosum. I love saying that. What is that? Oh, it's fifth disease. Fifth disease. And then this is when you're like, yeah, it's the fifth disease. It's not the first disease, it's the fifth disease. So that's a good thing, right? So pretty much here, guys, we got erythema infectiosum, otherwise known as fifth disease. It's a virus that kids get, and it's called fifth disease because it was the fifth skin eruption that was discovered way back in the days, behind scarlet fever, measles, rubella, and erythema sublutum, if I said that right. But anyway, it's a viral infection that kids get, and it causes a skin eruption on the face. Usually that's where it starts, and then that's when they'll come and visit you. Usually kids are kind of irritated, and they have what's called this slapped cheek appearance. As you can see, the cheeks are red, so it looks like somebody slapped the baby. I don't suggest you ask the parents if somebody slapped the baby. That's not funny. But what you do notice is that the rash spares the chin, alright, and the mustache area just underneath the nose. And if the baby closes its eyes, you'll notice that there's no rash as well. So slap cheek appearance, sparing of the chin and the mustache area, beautiful. Those are your clinical pearls right there. Mild fever that started 2 to 3 days before. And maybe some sick contacts as well. So this is when you tell the parents that fifth disease is a virus. It's usually self-limiting, so you just want to treat the symptoms, control fever, make sure that the baby is having an adequate PO intake, and also teach the parents about the progression of the rash. So the rash is going to progress onto the trunk. So usually this rash stays on the face for about 4 days, 1 to 4 days, and then it's going to progress to the trunk and then to the extremities. And then before it goes away, it can last up to 21 days on the extremities. So you just want to educate parents about that. Usually what I like to do, depending on the season, is I usually like to check for strep and flu as well. You might have, sometimes I've had kids with this, but they've also got strep infection as well. So if you're able to, that's an option as well. Can they attend school? Yes, they can. Usually when they get to the rash stage, they're not contagious, so yes, they can go ahead and attend school. Just keep an eye out, make sure parents are controlling fever and hydration. Alright. I like this rash. It's nice and simple. Usually comes with an easy clinical diagnosis. Erythema infectiosum. Fifth disease. 1, 2, 3, 4, 5. I'm out.